Today, we're diving into something pretty wild, a condition that can take the most normal things, like swallowing or even laughing, and turn them into pure agony. Seriously, just try to picture it. You go to take a drink, maybe just swallow, and bam, you get hit with this intense, stabbing pain, like a jolt of electricity right in your throat. And this isn't some made-up what-if scenario. For some people, this is real life. It's a rare condition called glossopharyngeal neuralgia, and it all comes down to one single very important nerve. So, let's get into it. What's the culprit here? Well, to understand this pain, we've got to meet the nerve that's causing all the trouble. Okay, so first, let's unpack that word neuralgia. All it really means is nerve pain. And the best way to think about it is like a faulty electrical wire, right? Normally, the current flows smoothly, but with neuralgia, it's like the wire is frayed or something is pressing on it, causing it to short circuit and send out these sudden, painful jolts. A lot of the time, that something is actually a nearby blood vessel just messing up all the signals. And here's where it gets super interesting. This is where our faulty wire, that glossopharyngeal nerve, actually starts. Look at that. It comes right out of the brainstem. I mean, that's like mission control for our body, right? The command center for so many of our most crucial functions. And this is what really paints the picture. As that nerve leaves the brainstem, just look at the route it takes. It weaves right through all the parts we use constantly for talking, eating, and swallowing. We're talking the tongue, the throat, the tonsils. Its location is everything when it comes to understanding why the symptoms are what they are. Okay, so we know where the nerve is. Now let's connect the dots and see how that location makes everyday life, well, excruciating. Because of that very specific path it takes, a whole bunch of totally normal things can trigger an attack. I mean, just look at this list. It's the stuff of life, right? Chewing, smiling, swallowing, sneezing, yawning when you're sleepy. For someone with glossopharyngeal neuralgia, every single one of these simple acts carries this hidden threat of triggering that awful sharp pain. Yeah, just let that sink in for a second. Being afraid to laugh at a good joke, or fearing a sip of cold water on a hot day. It's hard to even wrap your head around, and it really shows you just how devastating this can be to someone's quality of life. So this brings up a big question. How do you even diagnose something like this? The pain is debilitating, but it's totally invisible. Well, this is where doctors have to become detectives, and it's actually pretty fascinating how they figure it out. Because think about it, throat pain could be anything, right? A dozen different things. So how can a doctor be absolutely sure that this one nerve is the problem? The answer is really clever, and it involves a super targeted procedure. So here you can see how they do it. On the left, that's the spot, the general area where the pain is felt, right near the tonsil where that nerve is passing through. And then on the right, you see the crucial step. A tool is used to give a very, very precise injection right into that spot. This whole thing is called a nerve block. And basically, as you can see here, the doctor gets in there, carefully finds the path of the nerve, and then injects a local anesthetic. It's a lot like the stuff a dentist uses to numb your mouth, just for this specific nerve. And this is the light bulb moment. If that injection makes the pain just vanish, even for a little while, boom, they've found the culprit. It's definitive proof. The glossopharyngeal nerve is the source of the problem. The faulty wire has been identified. And that is a huge deal. Because once you've found the source, you can actually start to treat it with everything from targeted medications to procedures that can relieve that pressure on the nerve for good. All right, so let's zoom out a bit. What's the bigger picture here? What can we learn from this one pretty rare condition? For me, it's just a stunning lesson in how unbelievably complex our own bodies are. It's so easy to just go through our day and take everything for granted. But something like this is such a powerful reminder that our ability to taste our food, to swallow a drink, to speak, it's all run by this neural network that is just mind-bogglingly intricate and sometimes really, really fragile. And that's really the thought I want to leave you with. Every single thing we feel, every little pleasure, every move we make, it all depends on these quiet signals firing perfectly in the background. It kind of makes you wonder, doesn't it? How much of our whole experience just hangs by one of these tiny, delicate threads.